hook up just a bit. So
that feels so nice.
what, just running the meter?
Yes.
Cool. So we're getting at the base of the neck to start around T1 on the left side, about a 15-pointer. We're getting it at the top left, about a 7-pointer around C2. I'm pretty sure, yep. Let's see what happens though. It's gonna keep going. All the way down to the bottom, there. Okay. So this one's actually a little misleading. It looked like a break at first, but it doesn't stop at 0, it keeps going. Doesn't stop there either, it keeps going all the way to the bottom. So what that tells us, this one here is causing a lot of compensations in this part of your spine, okay? Because if we're looking for that definitive break. When it starts to go, it doesn't stop at 0, it passes 0, keeps going, and it's just it was fluttering all the way down. That's just muscle activity. So major we're finding, T1, left atlas, and sacrum. Those are just the pressure reading. First thing we're finding is upper cervical. That seems to be the theme today, Jeanette.
Yeah.
Cord pressure up top or upper cervical. There's a big reading up top, and it's starting there. Now, if the signals aren't going down from up top, what does that do to the rest? And there's the big one. It's interesting that this is a common thing. Someone says, I have got a pain between my shoulder blades, and all of a sudden my digestion is out. Just something we've noticed a lot. So definitely around T6, 7. Now, we're not going to introduce or have to add anything to your life except figure out where the nerve pressure is and get you adjusted, okay? That way we have no other variables to rule out. We're getting pressure here, base, L5 sacrum. We're getting here on T6, T7, and we're getting up top in the atlas here. Okay, we're starting at the base of the neck. And I'm just getting an overall feel. So as you can see on the meter, it's not starting up here, okay? We have about a 12-pointer, T2, T3, right there. 15 points. Madam, your neck is starting here. T5, 6 area, maybe 7. We also have to make some clinical decisions today, okay? We're not, just because I'm getting all these readings, doesn't mean I'm adjusting all of this. We definitely have a reading here. We definitely have a reading here, around 6, 7. And all of this is going to start down in her foundation, low, S3, S4 even. Okay? I'm getting pressure here, I'm getting pressure here, and I'm getting pressure here. Okay. I'm not getting anything today in your neck. It doesn't mean as we adjust this, things may shift out, something shows up, I work on it as I see it. Make sense?
This area right here feels like I always need to dig something in it.
This part here, right?
Yeah, like it's like here, kind of.
Okay. So we need to talk about the sacrum. We need to talk about the lumbar spine. This is the major thing that we're going to need to address and correct in order to get you back to balance, okay? So a couple of things going on in the sacrum, but before we go there, let's talk about what we see on the meter. So we're getting a small, oh, there it is. Started out small. Started out balling, ended up hustling. Started out at 5, became 18. There we go. So we're getting about 17, 18 points of pressure on the left atlas. So what else? We're getting about 10 points around T4, 8 points. There we go. There it is. Let's continue through. Alright, let's continue all the way through. Mid-back is nice and clear. And now when we get down sacrum, now here's the thing. The meter is reading inflammation, right? This thing has been there a while. We're going to find it there, but we're not going to get a huge reading down here, like 2025. I don't see that, only because it's an old injury that's kind of been compensating over the years. So we got about an 8-pointer, 10-pointer, about an 8-pointer here, and we have about a 18-pointer up top in the atlas, okay? Let's start at the base of the neck. You can watch here, you're not in it. You can watch up here. And when we start at the base, and the first thing is 15, 20 points up around C1, C2. There it is. $15 around T4, maybe T5. All right, let's continue. We got pressure at the atlas. We got pressure around T4, maybe T5. As we're running it down, we got pressure, another 15 around L2, L3. Thank God it wasn't 5. But then again, it wasn't 5. Let's go low. Sit up straight. Okay. S3, S4 down low. Go. Let's just tilt it this way down the spine. I'm going to talk about tilting the scope later, not right now. But we do tilt the scope in certain situations, and this is one of those situations. S3, S4, L2, T4, C1. Those are the 4 pressure readings I need. Let's go ahead and run the meter on his back. We'll start at the base of the neck. Okay. And let's see what we find. And the first thing we find is a 15-pointer down around C3, C4. As we go down from the base, we get to right about... Now, there's a blemish here, yeah? What's this?
Tell them about it.
What's that?
I had a pimple size, either a growth or something there that I used black salve to pull.
Okay.
That's why it's a scar.
We have a good 15-pointer around T9. T9, possibly T10. And now let's check what's going on in the low back. Now, you were getting your L5 worked on all this time, correct?
Correct.
Yeah. I'm getting it down low, 10 points around S2, S3. I'm getting it down low here. I'm getting it around T9, T10, and I'm getting it around 3rd, 4th cervical. I'm gonna
Is
run
that
a meter on your back, okay?
Okay, perfect. The first one is that I walked a lot. I usually don't walk at all. And obviously Vegas,
Okay.
you usually have to walk everywhere because everything is so close. And I noticed that I would never get tired at all, ever. I never got tired, not only once.
How did you sleep?
I slept perfect. I slept how you told me.
Okay.
Like on my side and, you know, with the pillow between my legs and everything.
How's the jaw? How was the breathing?
Oh, perfect.
Your upper neck is clear.
Here's where it hurts usually, right here.
And that's where I'm getting it today, by the way, right?
Yeah, that's freaking horrible.
There. Cool. Okay, so we're getting pressure at T2. Her neck is clear, upper neck is clear. You did really well in just a few visits, yo.
Thank you.
So the challenge is, did we fix everything yet? No. Did we start the process? Yes. We'll probably be seeing you back here in a couple of months. Okay?
Yeah. I feel a lot better, and that's all that matters, honestly.
Correct. So was it worth the trip?
Yes. Yes, it was.
Cool. Mama?
I'm here.
Everything looks good here. So remember that one you weren't gonna like me?
Oh my god, again?
Was that okay?
Yeah.
Like no issues? You didn't get anything
No,
tied in
no.
here?
I thought you were gonna do it again. I'm like, oh.
We are gonna work on that
Oh.
one. T2, T10 area. Guess what? Sacrum is clear. I get to work on your pelvis today. All right, so we're dealing with mainly posture and knots in the upper back, and we call it crepitus or crackling in the left knee. So the first thing we're seeing is what? As we're running the meter on the spine, and if you just look at the meter up top, we see we got a lot of pressure here at the atlas C1, about 20 points on that left side. Okay, that's the first thing. Okay, as we run it down. T4, T5 on the left side. And going down, we have not a lot of action here on the base. Most of this is going to be coming from her pelvis on that left side. And that's part of the kinetic chain, right? Pelvis, hip, knee. And I'll explain that in more detail when we continue. So, I got about a 5-pointer here, 5 here. The majority of it is in her upper cervical. And the first thing, we're actually getting a big 25-point reading. Top, C1, left side. We're getting 15 points, C7, T1 at the bottom as well. Now, you said something interesting in the consultation. You said when you look up and turn is when it hurts. Yes, and we're going to talk about that. That's part of a test that I do, actually, called divorce test. We got about a 10-point reading here, T6, T7. All right. T6, T7, 10 points on the left. Let's continue. Sit back a little bit for me, please. Scoot back. Make that 15. All right. Upper lumbar is clear. And all of this down in the low back is starting down in his sacrum around S1, S2. Right there. Okay. Head down, please. There you go. And it looks like that's where it's starting from. You work for somebody, you work for yourself?
I work for
For myself and for somebody.
Good. So we're getting a big pressure reading at the base of the neck here. Upper neck is good, still there. C7. Your sleep is okay? Your digestion is okay? You sleep okay?
I sleep like probably 6 hours.
Now, whenever you've had these pains, what have you done for it to make it feel better? Excuse me. Nothing? Deal with it?
Yeah.
No hielo?
No, my brother, it's worse.
Your brother is worse?
Yeah, he can't wait. Sometimes he can't wake up.
That's not good, man.
Mhm.
So the idea is you got to be at your optimal best so you can work and play as hard as you want, you know?
Yeah.
So we're definitely also getting a big reading down at the base of the spine. Remember I was telling you in the tailbone area?
Mhm.
Yeah. Here, here, and here. Those are the three big readings I'm getting. So let's start and see. Are you feeling something today, Leah?
The last couple of bits I've been, my back here, kind of where it was bothering me before, is still bothering me.
Okay.
And then my neck's always kind of hurting.
Okay.
And you know, the knees. I have another marathon in like 2 weeks, a week and a
Okay.
half.
Okay.
So,
All right, so what we're going to do today, let's tune you up, let's see what's going on, okay? And then we're going to share something that I'd like you to use for your marathon, but we're going to test it out to see. And it's an insert I've been using that increases lateral stability, range of motion, and actually decreases a little bit of pain. So I'm going to do a test with you, and you're going to just tell us like it is, okay?
okay.
And first, let's check spine. We got a little bit at the top atlas. Nowhere near what it was before. We got a tiny bit around. Oh, hold on. T7. Did we have a little extra sugar?
I always have about sugar. I love sugar.
What kind of sugar?
All of it.
What about maple syrup?
I mean, sure. Is that specifically what you're reading?
Well, what I like is I like using maple syrup as much as possible, and the reason why is the body metabolizes it a lot better.
Oh.
And maple syrup is a great alternative. You get the sweet. 10 points, L5. 10, 11 points, T around T6, actually around T7, T8, and C1. Who's that?
This is my cat,
What's your cat's name?
Fenya.
Huh?
Fenya?
Fenya?
This part is painful.
Well, that's where it's coming from. It's starting way up high, left atlas. T5, T6. Right there. Breathe. Take some deep breaths, Kate, please. Thank you. Your breath is off. That's what I was feeling in your pulse. T5, T6, we got about 10 points there. C1. And look at this. Watch this. I want you to see this. As we go down, it looks like it's to the left, but then it immediately shifts and it's way down low. Okay, start at the base. If you want to come here, you can see. Come up here on the table. Go on your knees here.
Yep.
On your knees.
Aquí en tu rodilla.
Okay.
Te arrollas aquí para que veas.
Yeah, that way you can see. So this should be 0. This should be in the center.
Cuando está en cero está perfecto.
See.
Okay.
Okay?
Okay.
Poquito. Mucho. ¿Sí?
Mm-hmm.
25. Ven, 20.
Mm-hmm.
20. Now let's follow it down along the spine. So all her neck issues is coming from here. It's not coming from here.
Mhm.
There is pressure here, yes, but it's starting here.
Yeah, it's telling me. Show that there.
Oh my gosh.
Número 3. Cycles every month, normal?
Yeah.
No issues?
No.
Okay. Knee. Anything with the knee I need to know about?
No, nothing.
Okay. Sit up straight. S2. S2, L3, T3, left atlas.
Yes, I'm so happy.
All right, so we're working on upper neck, T6, L5, and we did right pelvis, correct?
Mm-hmm.
So T6 is going to be one of the majors in terms of getting all this fixed up. Okay, looks pretty good.
I feel way more different than yesterday. Than that day I came, I'm sorry. A lot lighter.
Same combo. Guess what, Mama? Mama, come here. Mira. No nada.
Cero.
Cero.
Mm-hmm. Good.
Señorita,
Yes.
no nada.
Okay.
No nada en su cabeza.
Remember when yesterday you kind of pushed me in to like fix my posture?
Yeah.
Okay, now if you do it, I won't feel anything. Like remember
Well,
that day that
we're
my
gonna
hurt
take
so
a look.
bad.
Don't worry. So I don't need to mess with the neck today.
Yes.
Okay. So you're off to continue your vacay.
Yes.
Good. So let's run the meter. Now you remember what we were working on, right?
Yeah.
Muy bueno. Neck is clear today, yo. Very nice.
That's actually so exciting.
What's that?
That's so exciting.
T3. How are your shoulders doing?
Better. I remember how I came with this really hurting
Yes.
so bad. Well, today it doesn't really hurt. Like it just hurts like a little. Like if I stand like too much or something. But right now I don't really feel it.
Sleep last night?
Oh, perfect.
Good. She may not like me when I do this one, but it's gonna be muy necesito. Necesito.
Necesario.
Necesario, sorry. All right, so don't excuse my ghetto in Spanish,
The
okay?
class in Spanish is free.
Is it free?
It's free for you.
Okay. Nothing, dude. 5 points. 5 points. Muy bueno. You want the good news now?
Yeah.
Okay, we have 5 points here. We have 5 points here. We have this one that showed up. And this is the one that's going to do this. Watch. Let me do it. Let me do it. It's going to feel a little
Yeah, I
weird.
don't think I'm gonna like you.
You're not going to like me, but it's okay. So, we're giving her her first spinal exam today. And in terms of symptomatology and things that are going on, we can go over that later. What I want to focus on today is where is the nerve pressure in the spine. So we're getting a 12-point heat differential here. The areas that I'm marking are the areas that I'm finding an issue, okay? And that's the area, those are the areas we're going to focus the exam on. Any major accidents or traumas in the last 4 years that I need to know about?
No.
Okay, good. I found your anxiety problem, by the way.
Yay.
I don't want to give it away too fast, though. Alrighty. So I found 3 areas. I'm finding the tailbone down here. I'm finding around T10 here, and I'm finding around C7. Those are the areas that I'm getting a heat differential on the meter. It means it can be one or all 3 of these areas today that we may or may not adjust. Okay, that's where we're going to focus the exam, though. Let's go ahead and run the meter on his back, and let's see what we find. Head down, sir. Let's start at the base of the neck. Let's run the meter up. And the first thing significant here is going to be 15-point break around T6, T7. There we go. 12 points. All right. Let's see. These are old injuries also that you've had, right, sir?
Mm-hmm.
You've had these for quite some time. Looking at your low back disc, your original injury is over 30 years old. You know that, right?
Yeah.
It's way over 30. And this is where we're going to start down low in the sacrum. 15 points. We got about a 15-point reading here and about a 12-point reading here. Those are the 2 majors, okay, in the spine that I find today. And I know this is going to be starting at the top right, 25. Do you see that? Okay. And that is consistent with divorce tests that we did. So it's all starting up here on the top right, sir. Look how the needle is sticking the whole way. Do you see this? He has atlas cord pressure. So as we're running the meter, first thing we're getting is right around T3 on the right side.
Yeah.
10 points.
Hurts.
What are you guys gonna get into while you're here?
What?
Sightseeing? Right side again. 5 points. Now, as we go down, here's what's interesting. I have to follow the contour. Is this your current sitting
Yeah.
posture?
Literally.
Okay. There it is. So we're getting it down low. Around S3 on the left, down low. All right, so we have down low S3, we have around T10, we have around T3. Let's check the neck. Head down, please. And all of that starts where? We got a 15-pointer left atlas. Here. 1, 2, 3, 4. Now, let's start at the base of the neck. Let's see what we find. What do you know? 12 points right side. Okay. Do me a favor, after today's visit, you're here, go shave this, please.
Okay.
All right? Make it easier, more consistent on the readings. So 10 to 12 points, right C1. 10 points around T5. So nobody told you surgery for your nose or your jaw? No. So what did they, no one told you, what did they tell you to do?
It's like they didn't think that a chiropractor could actually do that.
No, but so what's the solution for your nose and your jaw?
There's another way where they put like a rod into the nose. It's like it's not sharp, it's round, and they just force it in place. And they add, I think, like some stems on it. Anesthesia, of course.
Yeah.
And then for the jaw, like they anesthesia as well, gloves, and they force it in place for trying to find it more or less. I saw that like, whoa.
But if you're under, but hold on, if you're under anesthesia, you don't feel it, so what's the problem? Why wouldn't you think about that? I'm just curious. I'm trying to understand you.
I guess I'm more looking forward to the chiropractic way.
Okay. Well, we're getting pressure down in S3, okay? S3, T5, C1. Those are the main three readings I'm getting today. And we're starting at the base of the neck. Now, with all that, what are you feeling today?
What am I feeling?
Yeah, what's going on today?
Like, as far as what?
Why are you here?
Oh, to continue from last time, like, I'm having some knee injuries. Not injuries, some, like, problems with my knee.
So we went over that, too, in terms of the knee x-ray and the alignment. We'll assess the knee.
Right.
The right one looked worse on the x-ray, but as we said, rule number 1 is never adjust an asymptomatic knee.
Right.
Okay? So I'm getting about 8, 9, 10 points of pressure at the base of the neck, C7. Top is fine. Yep. Base of the neck, C7. Around T9, T10, left side. Sit up a little straighter for me. And it's left knee, and we know there's a left pelvis and a left sacrum issue.
Right.
So first visit, we're probably not going to touch the knee.
Mm-hmm.
We're going to address, like we said, the foundation. And we got 15 points down low. We're on S2, S3. Now, let's start at the base of the neck. Bueno. Your atlas is clear, by the way, up top.
Yay.
That was from yesterday.
That hurts right there.
Yes, ma'am. T1. T1 left side. So we did a good call in terms of not touching T4 and 5 yesterday. The thing I don't like is that we did the right pelvis and I really didn't have to do it, okay? Straight up. I mean, it was there. It did help, yes?
Yeah.
But it's not the fix is what I need you to understand, okay?
Okay. Oh yeah, it did help. I remember how good it felt right after that.
But we're not here just to make crack
Yeah.
sounds and feel good. We're here to
Yeah.
fix stuff.
Also, I was probably gonna feel good for a couple of days.
Bueno. You okay?
I'm super okay.
Good. S3. Left side. 8, 9 points. S3, T9, T10,
Ow, that.
T1. Let's see what's going on. If you want to share kind of how you're feeling and functioning since we started. It's been a few days.
Yesterday I was able to sleep well, especially my right side, the lower back. I could feel that it was getting better. I didn't feel that kind of discomfort that I had before. So I was able to sleep through the night without waking up.
Okay.
So
That's a good
I'm able
thing.
to walk. Yeah, I'm able to walk freely. At least this leg I can feel some kind of, change.
Your right leg.
Right leg, yeah.
Okay. And left leg is still the same.
Yeah.
Okay. So sleeping is a little bit better.
Better, yeah.
Okay. And walking, you said?
Yeah.
Okay. And you understand everything we found on your x-rays?
Right, right.
Yeah? So we just have a little bit of a process to go through.
Yeah.
And we'll be making some decisions. We decided we'll stay a little extra longer. Just to get things holding a little bit better, and then when you get back, we'll have somebody for you to follow up with over there, okay?
Yep.
Now, this is pretty interesting, madam. Your neck is clear. Neck is clear. Mid-back is clear, madam. Let's bring the thermocouples a little bit closer together. The only one I'm getting today is S3, still 5 points. This is clear this morning, okay? Okay, let's continue. Let's check the motion of the pelvis. I have a feeling we're going to work on the pelvis and sacrum. Starting at the base of the neck. And the first thing we're getting is C4. 15, 17 points. 10 points around T6. There it is. It's down low. S4. S4, S3, S4, T6, T7, C4, C3 or 4, okay? Next thing we want to do is let's go ahead and evaluate the pelvis. Scoot forward. Now, let's see what we got going on today. We're going to start at the base of the neck. And we did work on the base, right? C7. And after our first visit, the upper is still clear, young lady. Awesome.
Great.
Now, here's
Very
the
hurts.
yeah, but here, check this out. It looks like it's going to be a break like yesterday here at C7T1, but it doesn't stop. You see that, mommy? It goes all the way to there.
Wow.
Things have been decompressing a lot. Now, remember we talked also about this. You're like the enigma, you know that?
Yeah.
You keep unraveling different things. It's not a bad thing, it's just challenging. You're not textbook.
You fix something and then something just moves.
Things are just shifting around. Now remember day one when you came back on this trip, T4, T5 was showing up. Yes?
Yeah.
So I'm getting about a 5-pointer there, but remember what I said about that. We said that it's probably compensating from this T10. Okay, so thus far I'm getting a little tiny break here. I'm getting a little bit at T10. We need to check down low, sacrum. Mama? 5. 5. Only 5.
Yes.
Only 5.
Pero es-
5, 5, 5.
pero está bien.
Time to go to Vegas. 5, 5, 5.
Before it's
See. So we're going to continue down on S3 on the left. Okay. We're going to continue on your T10. How can I help?
How can you help?
Yeah.
I don't know. First, I'm trying to fix my back. Then I'll do everything.
Your back is a work in progress, young lady.
I actually wanted to talk to you about the lift.
Yes, tell me.
Okay, so you gave me 2, remember?
Yes, 3 and a 5.
So the moment I put the 3 on, I couldn't walk. So I just didn't even bother trying the 5.
Okay.
So yeah.
So the lift didn't work for you.
The 5 was like too much.
What about the 3?
The 3 was perfect. Like in the beginning, I was walking super funny, but then
So you have the 3 on.
yeah.
Okay.
Well, not
Tell
right
me.
now.
No, but hold on, rewind, because you just said the 3 bothered you and the 5?
Yeah, so the 3, when I put it on first, like it was kind of like weird.
Okay.
Obviously, because I had something that was not.
You weren't used to it.
Yeah, I wasn't used to it. So,
Right.
But then after walking with it for a while, then it was amazing, and then my back did not hurt once.
Well, here's the cool part.
Mhm.
All of this is clear.
Yay.
So, Mama, we found an answer, or at least one of the pieces of her puzzle, and she's gonna need that heel lift that we prescribed, and you're gonna make sure she has it in everything. If you're doing sandals,
Okay.
this is your challenge because you're in Florida and it's hot, and you ain't gonna wear
know.
closed shoes all the time, are you? So what you need to do then is what? I would figure out how you can get something like that. I'll take the 5. I'll give you another 3, okay? And the other thing you can do is you can find a cobbler a shoe cobbler, to just put an extra 3 millimeters in your sandal on the sole, build it up. And it's not forever, it's temporary.
What do you mean?
Meaning things will shift around with you.
So when he like shifts and stuff, when I'm okay, then I don't have to wear it again.
Correct. But we
Oh,
have-
yeah, of course.
But we have to get there, right?
Mhm.
Mama? Everything. And she was driving with you in the car.
Ah.
I got here.
Yeah, there it hurts.
I'm gonna check on the pelvis, but this is all clear.
Yay.
It's pretty good, Mama.
Dr. Rahim.
Not bad, huh? So the first thing I'm doing, I'm running a meter on your spine.
Good.
And this is going to help us kind of determine where the inflammation is to focus the exam. So I got a little bit going on the top left atlas. We went through your x-rays. And we talked about this left pelvis is what started everything. And it is possible that this, whatever happened when you were in Germany, that wasn't the cause, by the way. That was a trigger.
Oh yeah. Oh.
That was just a trigger. You've had these issues for a while. And it could be from horseback riding. It could have been from any of the sports you were doing. Okay? Regardless of what it was, we gotta figure out what it is.
Nice.
Okay?
Good.
Cool. We got L5, we got around L5S1, we got around T6, T7, and we got at the base of the neck at C7, T1. So I got 1, 2, 3, 4 areas of potential, okay?
Okay.
All right, so as we're running the meter, we're getting a big reading here at Atlas on the left side. All right, T7. All your stuff is left-sided in terms of your pressure readings. So on the meter, I'm actually getting a huge reading right there in the Atlas, left side. All right, so we got pressure here, top left, about a 15-pointer. Do you ever get an acid feeling in your throat?
Yeah, that's another thing. You know, sometimes I'll have that acid reflex pop up.
So the reason I asked, I was getting a reading here. This is the area that controls the stomach and the liver, gallbladder. Okay.
Interesting.
Think of this like it's like a 24-port switch, right? Like your router,
Yeah, it's crazy.
right? But it's not giga, it's not tera, it's It's 100 times a millisecond that the brain communicates with every single cell in the body.
Crazy.
All right, we got a big reading here too, down in the tailbone and the sacrum. So we're getting pressure at the sacrum. We're getting pressure around 9-10. We're getting pressure around 5-6. We're getting pressure at the left atlas. He's clear up top. So it's all down low today. So we did already run the meter about 10 minutes ago, but just to make sure those are the same readings, they should not change, right? 5, 10 minutes or even a day later. And you can see that reading is still there at T4 on the left. That reading is still there around T9, T10. And the big one was down here at L5. There it is. So those are the 3 readings we're getting. Head up. Starting up top. Now, this is the area. We're getting pressure here around T5, T6 area. And then we're getting it down here as well. This is the area. We talked about adrenal kidneys and back, bottom right, there. So we're getting 4 spots. And we kind of knew those were the 4 spots anyway, right?
Okay.
How long is the drive?
About an hour and 45 minutes.
Wow. You're gonna need to make sure that you're hanging out here and having walking on Larchmont. Are you familiar with the neighborhood?
Yes.
Yeah, so just hang out for a little bit, walk for 15, 20. So we're starting off with some major pressure in the left atlas up top here, okay? So we do know there's upper cervical stuff. So we're gonna differentiate between the sacrum and the pelvis on the right, number 1. Number 2, we gotta check the base of the neck, and number 3 is the atlas. Those are your 3 pressure readings I'm getting, sir. Up top there. Okay. Yeah. About 10 points. Definitely half of what it was.
Mm-hmm.
And you said you threw out low back though.
Like
Mid?
Mid.
What are you doing? Jump shot?
No, just playing, honestly, and it, like, I felt it start to pull a little bit, and I just kept playing. So,
Low back actually looks pretty decent. C2, C1. T8, T9. So we're getting a big reading up top left in the atlas here. If the messages aren't coming down from the brain, how is it supposed to be working down here?
Mm-hmm.
Make sense?
Mm-hmm.
C1, C2, C7 on the right. Now watch the needle stays all the way right, all the way down to there. Neck is still clear, lady.
Sweet.
Isn't that weird though? No, seriously, you came in here for neck issues, right?
Yeah.
Neck and
Head mostly.
this head stuff, and
Yeah.
it's like we haven't even really
You did one neck crack.
that first, yeah, but we're after we got the films and we saw the reverse curve, we know we want to fix where it's starting from, which is down low.
Mm-hmm.
It's like 5 points at T1 today, by the way. That's really cool. We got about a 7-pointer here at around T5, T6.
Mm-hmm.
I'm getting here too at the
Mm-hmm.
around T11, T10 area. Good news. Clear up top. But that one's still there. What's really interesting with this right now is because you're so aware of your body, right? You're so in tune with it. She's actually giving me the information that I need, which makes the work to help her a little bit easier. So we definitely got the base of the neck. Nothing here in the mid-back, all clear. So it's not her sacrum, okay? We're gonna check the pelvis next. We'll sit down and we're gonna go through some breathing stuff together,
Great.
okay?
Mm-hmm.
So you'll at least have some warm-up and practice,
Mm-hmm.
because then I'm gonna up it a notch.
Gotcha. Okay.
So you want the good news or the bad news?
Bad news first.
There's nothing in your neck today.
Really?
It's
How's that bad?
because I can't crack you then.
Oh, okay.
You want the good news?
Lower back's good too.
There's only one spot right there.
Gotcha.
All right, so it's been about 2 weeks since I've seen you.
Probably closer to 3.
3 weeks?
Yeah.
How did you hold up down south?
Lower back is really, really tight and stiff. Like just limited range of movement, and
Okay.
I've been getting pretty huge knots in this shoulder.
So tell me from when you left here. Remember, we've been doing a little bit of work with you.
Yeah.
And then you went down to Miami.
Yeah.
Was there a point where, or a day, you started to feel things going back?
Back to worse. Does that make
It's
sense?
not back to where it was.
No, but like because I was getting really bad numbness through my left leg, so I don't get the numbness anymore, but I still do get the discomfort and the.
Any sharp shooting pains?
No.
Okay, good.
Like, but just tense, like just. I think it's that sciatica, like.
Yeah. And that goes back to what I said, right? This goes back to the 5th lumbar, Phil. All right? And all of this that we're going through is a symptom and a result of this 5th lumbar that we're dealing with.
Yeah.
So just on the visual, something doesn't look right here around C6. C7 is probably going to be his VP. And yep, there it is. Dead. Goes to the hot nerve, comes back. And it's interesting how it happened to be right where that kink is. And if I don't do his pelvis, his low back, that's not going to hold, by the way. So starting at the base of the neck, and we're getting a reading at around C1, C2 top. Getting around T3, T4. This area controls heart and lungs neurologically, by the way. Right? T12, L1. So what's interesting on you is we have breaks, but they're not huge deflections, which tells me it's been there a while. They're not acute inflammation, so they're not. These aren't like big injuries that happened right now.
No.
Okay. First thing is we're doing instrumentation, running the meter, and the first reading I'm getting is here, and something happened here, and that's what we're trying to figure out. What happened here? Also, the left pelvis is an old injury, but this is a shoulder case, a frozen shoulder. She was moving something, you know, at work, and she felt this pain when she did that. This happened, and how has this affected your quality of life now?
Simple daily life is just miserable.
Now, when we're looking at the overall quality of the spine, we can see there's not really a lot of curvature in her spine. There's a little reversal going on here. There's kinking through here, but mainly we need to start getting these curves back in your spine, okay? You see how it kind of just jumps around? It's like here once, here. So that's it. That's the one. So pressure readings I'm getting top left atlas.
Yeah.
This was mixing, I was getting it here, then here, then here. Now out of all that, it's here, around T3, T4, right around there. I'm also getting a reading at T9, and I'm getting a reading at L5. So let's start by checking instrumentation. Okay, so I'm getting top of the neck, left. I'm getting the base of the neck, which is what we worked on last time, remember?
It was not like, I didn't feel achy after the last adjustment. The best way to describe it would be like heavy. Like my arms felt heavy.
What does that mean?
Just, I don't know how to describe it.
After you left here?
Yeah.
Well, something needed to come out of you, and something needed to heal, and you needed that rest. 10 points, 5 and 5. You did really well with the first adjustment, by the way.
That's good.
Really well. He's in for this TMJ and sinus issue. He's had it for a while, and he's even seen a lot of specialists. No one's really given an answer, and this TMJ is really affecting his quality of life, right?
Yes.
Now, what I'm doing, so you've had chiropractic done, you had x-rays taken.
Yes.
They even gave me a shot of
Cortisone?
cortisone,
Yeah, when was that?
That was 2 years ago, and I stopped doing it because it feels like it's ruined me in some ways.
Yeah, the thing with cortisone, it's just a long-term Band-Aid. Lasts maybe a couple of weeks to a couple of months.
And it get worse after that.
I think I probably found the issue.
That's my experience.
I think I found the issue, my friend.
Oh, wow.
But the proof is in what happens after. I'm getting a lot of pressure, right atlas, T1. I'm sure I'm going to get it here in the mid. Yep, right there, T6. By the way, this is the area that controls digestion. Yeah, you got a lot of pressure here, dude. Down in the low back. It's all starting at your 5th lumbar, my friend. 6th, 7th thoracic, 1st thoracic, 1st cervical. 4 pressure readings I'm finding, okay? And it looks like that's where it's starting from. So we're getting a big pressure reading at the base of the neck here, C7. Now, whenever you've had these pains, what have you done for it? to make it feel better. Excuse me. Nothing, deal with it?
Yeah.
So the idea is you got to be at your optimal best so you can work and play as hard as you want, you know? So we're definitely also getting a big reading down at the base of the spine. Remember I was telling you in the tailbone area? Here, here, and here. Those are the 3 big readings I'm getting. So we're going to start running the meter. And the first thing we see is we get a break around C5, C6. Now I mentioned we're probably going to find something in this mid area, right? There. And she's got a big reading down here on the bottom left, right there. That's the big one here. We know we're getting pressure at T1. We're getting pressure there around T8, T9. So this is kind of crazy. This is clear here from what we did last visit.
It's feeling a little better, but not fully.
Yeah, we're going to work on the pelvis today. So we'll start at the base of the neck, let it zero out. And you can see right
Yeah, a little jump right there.
there. And it should be consistent. So what that tells us is that's where we want to focus the exam, right? Now I'll give you another example. Let's say the person was complaining of pain right there. And I'm running the meter, but I don't find anything there. We don't chase the symptom. So the person could have pain there, and let's
What
say
could be caused by that?
it can come from anywhere.
Interesting.
Okay. So the idea in this work is we're looking very specifically for nerve pressure in the spine. Number 2 is to align all the extremities so the muscles are able to work efficiently. 0 down here. Now, the pelvis you won't get a reading from a pelvic misalignment. This is really to test the spine itself, correct. So how did you like the neck adjustment on the second visit?
Very good.
It was easier, right?
Yeah.
There's only 7 points now. We had about 15 when we started.
Oh, really?
Yep.
I mean, sleeping at night, waking up in the morning, I mean, the pillow feels so much better now.
Good.
Oh yeah, that's something she used to complain about all the time.
So that's already changed?
Oh yeah.
Really? In 2
Huge
visits?
difference.
Very nice. And let's start here at the base of the neck. Starting at the base. And the first thing we're going to see is left atlas, 18 points. Right? 20 points there. C1 on the left. C1 on the 18 points left. Can you see this? You can sit up here if you want. You can come up. Okay? I want you to be able to see it. Número 1. Número 6, estómago. Stomach. Now, we have to follow the contour of the spine because it goes this way. So we're following the contour all the way to the bottom. Now, when we get to the bottom, here's where it goes left, but the lower down we go, it goes right. So remember I was showing you those 2 issues. Down low, S4 sacrum, up top, S1. 2 issues. Okay, so we have, and that's what we need to figure out. So we have sacrum, we have around T6, and we have C1. Those are the majors nerve-wise. Let's come over here and let's look at the meter here, please. Head down. And let's see what we find. As we're running the meter up the neck, first thing we see is what? Neck is good. Awesome. C1 is clear from yesterday. Now I want you to notice something. When we run the meter here, it looks like there's going to be a break, but it didn't stop. So that's not the problem. It's still here, T6. T6. 12 points. Let's continue. As we get down into the sacrum, now you'll notice it's a lot less than yesterday, yeah?
Mm-hmm.
Today is only 5 points. Good. So today, we have here and here today, okay?